Hi, my name is Dr. Brittany Todd with Sacred Heart Clinical Pharmacy Specialties. I am a pharmacist, a mother, and a wife, and I want to start a series on birth control. I'm going to start with the history of birth control leading up to some definitions and then what actually we use for birth control today. So let's start at the very beginning. In Egypt, in ancient Rome, people were using birth control. They were using things like alligator dung, honey, certain chemicals as spermicides. They were using some forms of birth control even way back when. Maybe they weren't the most effective, but they were using them. Fast forward to about the 1920s, almost every world religion, especially the Christian religions, were against birth control. In the 1920s, the Anglican Church was the first Christian church to at least formally say that it was okay to use birth control within a marriage as long as the husband and wife discerned together whether or not, spacing children or not having any more children was prudent in their marriage. So the 1920s kind of opened the floodgates of permission, if you will, for the Christian faiths to say, yes, birth control might be okay as long as the discernment within a family is there. The Catholic faith has still maintained that birth control is still not okay. So that is the one faith, the one Christian faith, and there's probably a couple, random Christian faiths throughout, spread throughout the world that still believe this, but the Catholic Church is the one that teaches no contraception, no birth control. But the 1920s kind of opened the floodgates of accepting birth control. So in the 1960s, prior to the 1960s, the definition of pregnancy was the moment of fertilization. So a woman was pregnant the moment the sperm hits the egg and a zygote is formed and a new life begins. That was prior to the 1960s. If you look at the American College of OBGYNs way back when, that was the definition in their textbooks. But in around 1960 to 65, the definition actually changed. The definition went from the moment of conception was the moment of pregnancy to the moment of implantation, meaning that zygote that was fertilized is now implanted into the uterus. That's when pregnancy begins. So they changed the definition of pregnancy. And you might ask, why did they change the definition of pregnancy? Well, I'll tell you. In the 1950s, pharmaceutical companies started looking at ways to prevent ovulation or pregnancy, right? So in the 1950s, some pharmaceutical companies were looking at higher doses of estrogen and progesterone levels. And the first medication they started looking at were high-dose estrogen pills. The estrogen pills, birth control pills. And they were testing it on women, fertile women, and they found that the high doses of estrogen actually stopped ovulation. So if you don't ovulate, you don't get pregnant. So the pharmaceutical companies were excited about this. However, the women taking the birth control pills were not excited about this because they were having headaches, sweating, nausea, vomiting. High doses of estrogen don't make you feel very good. So they found that the women who took their medications felt awful. And then some people didn't take the medication, so they were getting pregnant, because if you don't take the medication, you're going to ovulate and get pregnant. So it wasn't effective if you don't take it, but if you did, you felt really crummy. So what they did is they thought, well, let's just decrease the estrogen dose of these birth control pills. So when they did that, they reduced it to a tolerable level where these women were not getting such major side effects, but it increased ovulation rates. So that didn't look good either. All of a sudden, women were getting pregnant on the pill in these studies. They felt fine, but they were getting pregnant. So you can't claim that this is a birth control pill if women are getting pregnant on the pill. So they decided, well, let's add in the progesterone component of the pill. So estrogen decreases ovulation, but it doesn't completely eliminate it most of the time unless it's very high levels of estrogen. So in the normal tolerated doses of estrogen, a woman can still ovulate. Doesn't mean she ovulates every time. It just means that she can still ovulate. And we can go over the ovulation rates on certain ones in a future video. But what they did is, because they lowered the estrogen dose and the ovulation rates went up, they couldn't have fertilization after after an egg was fertilized and they created a zygote, they created a new life. So what they did is they said, well, we can make it so that the uterus is hostile, meaning instead of being a nice cushy pillow for that little zygote to move into and implant into, it will make it dry and there will be no mucus, no cush, nothing for it to implant into. So the progesterone makes that uterus a hostile environment. It's like putting a toddler outside when it's negative 20 degrees and saying, I hope you survive, right? It's creating an environment for that zygote, that new life, to not implant. So what happens is they give you a lower dose of estrogen hoping that you don't ovulate, but then if you do and you happen to conceive a child, that child has nowhere to implant. That was its second mechanism. And they found out that, wow, lo and behold, women were not getting pregnant anymore. The problem was pregnancy before the 1960s, when they were developing these medications, pregnancy was defined as the moment of fertilization. So if they made the uterus hostile and that fertilized egg has nowhere to implant, it caused an elimination of a pregnancy, right? It ended a pregnancy. Well, most Christian faiths and most people at the time believed that if you were pregnant, they didn't want to end the pregnancy. They didn't want to kill the baby. So they changed the definition of pregnancy around 1960 to 65 when these birth control pills were first coming out on the market, from the moment of conception to the moment of implantation. Which means now people are being told this doesn't end a pregnancy, it prevents a pregnancy, because they shifted the definition by about 7 days. It takes about 7 days from the fertilized egg, that new zygote, to move down the fallopian tube into the uterus. And it doesn't implant. So medically, the definition of pregnancy is the moment of implantation. So medically, we're not eliminating a pregnancy, we're preventing a pregnancy. The problem is there is no definition for life. The definition of life is a growing, breathing, nutrient-needing thing, right? It could be a person, a dolphin, a plant, whatever it is. They need air, they need food, they need a good home, right? So this definition doesn't affect life, but it did affect the word pregnancy. So when they said that pregnancy did not happen until the moment of implantation, it changed the word for abortion. Abortion is the ending of a pregnancy. So what they did is, instead of ending a pregnancy in the beginning of fertilization, they ended a pregnancy at implantation. Do you see what they did? Their birth control pills were no longer abortifacients, or medicines that cause abortions. They are medicines that prevent pregnancy. They don't prevent life per se, they prevent pregnancy. That's the history of birth control, and I want to go into what kinds of birth control there are, and what are the risks of ovulation and possible fertilization and possible implantation as we go forward in these videos.